Should I start, Dr. Khansa? Let
Yes, sure, you can
Okay,
start your presentation.
okay. Bismillahirrahmanirrahim. Quote of the day: train your mind to see the good in every situation. Today, the topic of my presentation is sample size calculation for descriptive studies. Learning outlines are sample size calculation when prevalence is known, sample size calculation when prevalence is unknown, sample size calculation for infinite population, sample size calculation for finite population. Learning objectives. In the end of presentation, you would be able to determine sample size of cross-sectional studies. Now, types of descriptive studies. Let's have a look over what comes under descriptive studies. Case report, case series, cross-sectional studies. Case series, a case report. It is simply a summary of one individual's experience with a particular outcome. Sometimes a single patient's illness or circumstances is so unusual that it warrants publication. Case series, it is a summary of a series of individuals with the same outcome. For example, in 1971, two physicians reported a case series of young women with clear cell adenocarcinoma of the vagina. This type of cancer was an exceedingly rare tumor that occurred predominantly in older women. This case series led to an analytic study that documented the association between this cancer and have been exposed to diethylstroll in uterus. Third is, so we can see that a case report and case here do not require sample size estimation. And third comes a cross-sectional study. It is an example of a descriptive epidemiologic study that will be discussed further. Now, types of cross-sectional study. There are two types: descriptive study, analytical study. In descriptive study, a cross-sectional study may be entirely descriptive. A cross-sectional descriptive survey assesses how frequently, widely, or severely the variable of interest occurs throughout a specific demographic. Analytical cross-sectional research investigates the association between two related or unrelated parameters. Now, sample size calculation in cross-sectional studies. In cross-sectional studies, the aim is to estimate the prevalence of unknown parameter from the target population using a random sample. So an adequate sample size is needed to estimate the population prevalence with a good precision. The following simple formula would be used for calculating the adequate sample size in prevalence study. N is equals to z square p bracket 1 minus p over d square, where n is the sample size, z is the static corresponding to level of confidence, p is expected prevalence that can be obtained from same studies or a pilot study conducted by the researcher, and d is precision corresponding to effect size. Now, level of confidence. The level of confidence usually aimed for is 95%. Most researchers present their results with a 95% confidence interval. However, some researchers want to be more confident and choose a 99% confidence interval. The value of z-score. Since value of z is required in the formula, so it is needed to turn our confidence level into a z-score. Here are the z-scores for the most common confidence level. At 90% confidence level, it is 1.64. At 95%, it is 1.96. At 99%, it is 2.5. And we need to memorize this value because more commonly 95% confidence level is used. If we choose a different confidence level, we use this z-score table to find our score. Now, the value of expected prevalence P. This can be estimated from previous studies published in the study domain or conduct a pilot study with small sample to estimate the assumed P value. This assumed P is a very important issue because the precision should be selected according to the amount of P. If we hold the confidence interval constant, that is at 95%, and the precision at 5 plus minus 5%, then we can see that estimated prevalence, when we increase the estimated prevalence, sample size is increased. But when it surpasses 50%, then the required sample size gradually diminishes. And we can see that the sample size that is required for prevalence of 10 percent is same as that of the 90% prevalence. And in case of unknown prevalence, we assume it to be 50% or 0.5%. Sorry, here is a mistake. It is 0.5%. The estimation of precision D. There is not enough guideline for choosing appropriate D. Some authors recommended to select a precision of 5% if the prevalence of the disease is going to be between 10% and 90%. Again, to calculate sample size for estimate of prevalence with 95% confidence limit, we have this formula. This is called Cauchy's formula. Here the value of Z is 1.96, that is at 95% confidence limit. P is estimated prevalence. If it is in percentage, then we convert it into decimals, and D is desired precision, that is 0.05% for plus minus 5%. Now we come to examples. A researcher wants to carry out a descriptive study to understand the prevalence or proportion of diabetes mellitus among adults in a city. A previous study stated that diabetes in the adult population was 40%. At 95% confidence interval and 5% margin of error, calculate the samples required to conduct other new research. Here again, we are using that Cauchy's formula, and the value of Z is 1.96, as we have discussed that confidence interval is 95%. Prevalence is 40%, and in the formula we'll use it as 0.4. Precision is 5%, and in the formula we will use it as 0.05. On applying all these values in the formula, we get sample size of 369. Hence, for conducting a new cross-sectional study to identify the prevalence or proportion of diabetes mellitus among patients, minimum 369 subjects will be required. Now, there are different scenarios based on the different prevalence rate. Here we are discussing when the disease, when prevalence of disease is 10 to 90%. Here again, we are using the same formula. Example is, in a nearby town, the official record showed the prevalence of chronic malnutrition in children to be 20%. Calculate the sample size needed to carry out a prevalence survey. So here we can see that Z value is 1.96 and P, that is estimated prevalence, is 20% or 0.2, and the precision is 5% or 0.05. And again, putting all these values, we get the sample size of 245. Now, if disease is very rare, that is prevalence is less than 10%, then we will have some change in the formula, that is precision is equals to, precision will be half of when prevalence is 10%, less than 10%. Now, example, in village A, the prevalence of multiple sclerosis is 4%. Again, you can see that prevalence is less than 10%, disease is very rare. So while calculating the sample size, we will use this formula, and where prevalence is 4% or 0.04, and Z value is 1.96. Again, putting all these values in this formula, we get the sample size of 368. Another example, in village B, the prevalence of echinococcus is 13 per 100,000. Again, you can see the prevalence is less than 10%. Calculate the sample size required for an epidemiological survey. Again, putting all these values, 1.96 at Z, and prevalence is 0.013. And again, we are using this formula. So we get the sample size of 1,173.12. Now, if disease is very common, that is the prevalence is greater than 90%, then we have this formula, that is 1 minus precision over 2, and then we take the square. Example, in our village, the prevalence of common cold 98%. Calculate the sample size needed to carry out an epidemiological survey. The prevalence is 98, that is 0.98, and it is a common disease that is greater than 90%. So we will have this change in the formula. Then putting all these values, we will get the sample size of 750. Now, calculation of sample size for infinite population. This is the formula for sample size for mean, where n is desired number of samples, z is standardized value for the corresponding level of confidence. Again, at confidence level of 95%, the value is 1.96, and at 99% or type 1 error, it is 2.58. D is margin of error or rate of precision, and this sigma is standard deviation, which is based on previous study or pilot study. Example, suppose a researcher wants to know the average hemoglobin level among adults in the city at 95% confidence level, and the margin of error is 2 gram per deciliter. From a previous study, the standard deviation of hemoglobin among adults was found to be 4.5 gram per deciliter. How many study subjects will be required to conduct a new study? We can see that here this formula will be applied, that is z square sigma square, this is standard deviation over precision square. 1.96 as we have taken at confidence level of 95%, and the standard deviation is 4.5 and precision is 2 gram per deciliter. So applying all these values, we will get the sample size of 19. Hence, for conducting a new cross-sectional study to estimate the average hemoglobin level among adults, 19 subjects will be required. Sample size for proportion. This is the formula. N is equals to z square p bracket 1 minus p over d square, where z is standardized value for corresponding level of confidence, p is proportion, d is level of precision. Example, the proportion of nurses leaving the health services with 3 years of graduation is estimated to be 30%. A study which aims to find cause for this also aims to determine the percentage leaving the service with a confidence interval of 25 to 35%. The standard error would therefore be 2.5%. The required sample size would be here on applying the values, that is p is 30%, prevalence here we saw 30% or 0.3%, estimated error is 2.5. So applying all these values in this formula, we get the sample size of 336 nurses. Now, calculation of sample size for finite population, we calculate it through this formula, n over 1 plus n multiplied by d square. This formula is also called Solvent's formula, where n, capital N, is equals to total population, and d is margin of error or precision. Now, example, suppose a researcher wants to conduct a survey to assess the prevalence of regular foot care among adults with diabetes in a town. Now, if the population of adults suffering from diabetes is 2,500 and researcher wants to work at 95% confidence interval, where margin of error or precision were decided by researcher is 5%, find out the sample size for upcoming survey. So as we have discussed earlier that this formula is required for this population, then applying all these values, here we see that n is 2,500, precision is 5% or 0.05. So applying all these values in this formula, we get the sample size of 345. Hence, for conducting a new cross-sectional study to assess the prevalence of regular foot care among adults with diabetes, minimum 345 subjects will be required. Now coming to multiple choice questions. The average MCQ number 1, the average test score of all students in a certain class was measured to be 84 with standard deviation of 15. The margin of error is calculated to be 5.367 at 95% confidence level. The number of students present in the class can be calculated by following formula.
Alpha.
Yes, right answer is alpha. Now, suppose a researcher wants to know the average hemoglobin level among females in the city at 95% confidence interval and the margin of error is 2 gram per deciliter. From a previous study, the standard deviation of hemoglobin level among females was found to be 4.5 gram per deciliter. How many study subjects will be required to conduct a new study? I have MCQs where calculator is required. So I will tell you the answers. Here the hint is this formula as we discussed earlier. That is standard deviation is given and z score for 95% confidence level will be 1.96 over d square, that is error precision, which is 2 gram per deciliter. So what will be the correct answer?
B.
8.6.
No, the correct answer will be A. This, it applying all these values in this formula, that is 1.96 at place of z, and 4.5 we had the standard deviation 4.5, so we put this value here and over precision precision, and the value of error is 2 gram per deciliter. So here we put the value, that is 2, and applying all these values we get the sample size of 19.4. So correct answer is 19.4, that is A. In a study, the size of population is 10,000. Margin of error is assumed to be 2%. The researcher will get the sample size through the following formula: Solvins formula, Quotient formula, Yeaman formula, Altman's nomogram.
Solvents formula.
Yes, correct answer is Solvins formula. An investigator wants to estimate the proportion of freshmen at his university who currently smoke cigarettes, that is the prevalence of smoking, with a 95% confidence interval. Estimate of proportion of freshmen who smoke is within 5% of the true population. Which of the following value would he use as a P in the absence of information for proportion of smokers or prevalence? 0.5, 0.05?
0.5.
1.9.
Yes, 0.5 would be the right answer, because in case when we do not know the prevalence, we take it as maximum, that is 50% or 0.5. So the correct answer will be A.
2%.
MCQ number 5. Quotient's formula directly depends on all of the following except level of precision, desired confidence level, estimated proportion of attributes, standard deviation.
Standard deviation.
Yes, right. Because as we have seen in the formula that all parameters are used except for standard deviation. A researcher finds that 70% of students in the sample have adopted a recommended practice of submitting the assignment with a precision weight of plus minus 5%. Which of the following is not true about level of precision? It is the range in which the true value of population is estimated to be. It can be expressed as both percentage or points. The above scenario shows that 65 to 75% of students have adopted the practice. The above scenario shows that 70 to 75% of students have adopted the practice.
Alpha.
D.
D.
Yes, right answer is D, because we have the precision rate of plus minus 5. That is the range we will get is 65 to 75% of this 70% students. Assuming there is a large population and the researcher does not know the variability in the proportion that will adopt the recommended SOPs for COVID-19, so assumes value of P is equals to 0.5, that is maximum variability. Furthermore, he supposes confidence interval of 95% and precision of plus minus 5%. Sorry, the sample size would be 385 students, 300 students, 285 students, 425 students. Yes,
Good.
the correct answer is 385 students. How we will get? We will use this formula, that is Quotient's formula, and applying the values here. As we saw that prevalence we had is 0.5, And 1 minus p, again we will get the value 0.5 over d squared, it was 0.5. So it is, sorry, 0.05. Then the formula we'll get is, sample size we will get is 385. So right answer is A. In a city A, the official record showed the prevalence of diabetes mellitus type 1 in children to be 20%. The sample size needed to carry out a prevalence survey is 245 children, 350 children, 278 children, 180 children. Again, this question requires a calculator. So the correct answer is A, that is 245 children. How we calculated that Z score was 1.96, that is at confidence interval of 95%. P is 0.2 because we discussed that prevalence was 20%, that is 0.2. And D is 0.05 at 5%. Then applying all these values, we get sample size of 245. Now, MCQ number 9. Suppose a researcher wants to conduct a survey to assess the prevalence of less salt intake among adults with hypertension in a town. Now, if the population of adults suffering from hypertension is 2,500 and researcher wants to work at 95% confidence level, where margin of error or precision rate decided by researcher is 5%. The sample size for the upcoming survey will be 345 adults, 450 adults, 275, 290.
275.
Correct answer will be 345. Because here this formula will be used as the population is given, that is n is equals to 2,500, d is 5% or 0.05. So applying these values in this formula, this is sample solvents formula as we discussed earlier. So the sample size we will get is 344.82, that is 345. So correct answer is A. This is the key, and these are the references, and here we end. Thank you.
Thank you very much, Dr. Meha. Very nice presentation. I'm really impressed, especially the MCQ part. It was excellent. I wish sometime when we were in class, we were in face-to-face meeting, we would have more practice sessions for sample size calculation. As far as today's lecture, it is wonderful. I would also like you to please tell us more about Fleece formula for sample size calculations, because usually we are comparing two groups and we have different values in two groups. So what will you say about Fleece formula?
Ma'am, I would discuss it in my next presentation.
Okay, thank you very much. Excellent. So we are looking forward to your next presentation, and I hope the MCQ part in the next presentation would be as wonderful as today's presentation.
Okay,
Very
ma'am.
nice. Well done. Allah
Thank
Hafiz.
you. Allah Hafiz.